Today we're going to talk about ways to help keep your existing hair growing strong. So there's a lot of different categories. There's medications, pharmaceutical treatments, there's non-drug treatment options. There's things that we do in the office and there's things that we do at home. Everything from hair care to nutritionals and nutraceuticals. So stay tuned, we're going to talk about the ways to keep your existing hair growing strong. The most effective kind of non-invasive treatment options are typically a combination of therapies. So sometimes patients will use an at-home treatment with something we do in the office. Sometimes patients will use a combination of non-drug treatment options. Sometimes we'll focus exclusively on pharmaceuticals. But there's no doubt that a combination or multi-therapy approach is going to get you the best results. Which treatment option or combination of therapies is right for you is something you're going to talk about with your doctor. In the pharmaceutical category, we have the traditional FDA-approved medications like Rogaine minoxidil, Propecia finasteride, but we can also apply those in different ways today off-label using compounded pharmacies. So we can apply, for example, minoxidil orally instead of with a topical. We can apply finasteride topically instead of orally. And these are done to improve efficacy and to reduce side effects. Some of the different types of pharmaceuticals you might see addition to finasteride and minoxidil that you would see traditionally would be dutasteride, which is another DHT blocker, and even prostaglandin analogs. These are all pharmaceutical compounds that can be used on the scalp to help improve hair growth. Some of the more popular compounded topical medications that we use here in the practice at Bauman Medical would be 82M, 82D, and 82F. So for patients looking to avoid side effects from medications, we have a lot of non-drug treatment options. So these are non-pharmaceutical categories of treatment, such as low-level laser light therapy, good nutrition and nutraceutical supplementation, in addition to regenerative medicine technologies like PRP, PDO, exosomes, and so on. As we've mentioned before, very often a combination of therapies gets the best result. We're hitting the follicle in a number of different ways. We may be protecting the follicle with one therapy and stimulating it with another. A great example of this would be a non-chemical treatment option, such as a combination of low-level laser light therapy that you would do at home and a regenerative medicine treatment that we do here in the office, like PRP or PDO. When you combine these types of therapies, you avoid the pharmaceutical side effects that commonly occur, and you can get a great result in terms of hair growth. Another great example of combination therapy would be doing something at home, like a topical or oral treatment, and something in the office, like a regenerative medicine PRP or PDO treatment. In this way, you're doing the treatment in the office, which is setting things in motion really for about a year or so, and you've got your homework to do at home ongoing with the medical treatments. And these two types of therapies work very commonly together, synergistically, to work and will monitor your hair growth over time and the success moving forward. For those patients who are trying to focus on DHT as the primary trigger of their hair loss, we have anti-androgen therapies. So anti-androgen therapies might include pharmaceuticals such as finasteride or dutasteride, which can be applied orally or even topically, and dovetail that with nutraceuticals like saw palmetto, which can be taken orally or included in a hair care regimen, shampoos and conditioners and so forth, hair care wise. So putting all of that together will block the DHT, which, as we know, is the common trigger for male pattern hair loss and some female hair loss as well. In conclusion, as we've said, multi-therapy works best, so choose a regimen that's synergistic to protect the hair that you have. And if you have any questions about side effects, concerns, whether you should use a medical therapy regimen or a non-chemical, non-drug treatment, connect with me virtually or come in the office and we'll track your progress and your hair growth over time.